Hello again, everyone. Edwin Learnard back once again in this YouTube segment. We're going to be talking about COVID-19 slash coronavirus and the importance of mask wearing. Now, most of you heard about this for some time. I know it seems like it's getting redundant and monotonous or what have you, but I want to speak my piece basically on this matter, and I think this is a very critical time, people, that we gotta, for those that don't think you need a mask, and you say you don't want to live in fear or some state of trepidation. Well, the thing about it is, if you don't wear the mask, the surgical COVID-19 mask, I call it, you might be in more fear if you actually get it, and you put others in fear by not wearing it. And the thing about this is, it's very important, now more so than ever, to take the precautions that are necessary for this. We're not far from winter right now. We're about a month away from officially going into the winter season, and it's time to put aside our arrogance, any self-centeredness, saying you don't want to live in fear, you don't feel like taking precautions. You're going to become, complacent and relaxed. This is a time right now. That the most of you out there know that this thing is really escalating big time. I was looking on the data for, I think it was on November 19th for 2020, of course, and on the New York Times report had something like 187,000 around there for confirmed new coronavirus cases per day. And it's nothing, this is not a hate parade against Donald Trump or anything, but Donald Trump, I don't think, is going to do much to mandate any kind of mask wearing or do much to really talk about our precautions to take at this time. And he is going to be in office for about another 2 months. And this thing is going to grow and escalate very rapidly during this period. So it's something that we have to understand and come together and do what we have to do to take these precautions that are necessary and wear and at least wear the mask. Some people even wear goggles. I've even gone out wearing goggles sometimes, and some people see that as being a little excessive and extremist or what have you. But the thing about this is, people out there, that have had their conspiracy theory, and they say, well, gee, why, you don't get that many cases. When was the last time you got that many cases of the flu? Well, a statement like that could actually enhance the argument for the coronavirus, COVID-19, being real and voracious, because if you didn't have that many cases of the flu in the past per day or what have you, then you wouldn't have them now. So it tells me there has to be something else involved. Now, somebody told me that there were some tests that had gone on, and I don't know, I haven't confirmed this, but this is speculation. It's based on what somebody said to me, that this thing with the COVID-19, that some people have gotten tested for it, and it showed a positive result for COVID-19, but it was actually the flu. I don't know. I haven't confirmed whether this is true or not. But even if that is the case in some instances, I think at this point in time it would be safe to say that a lot of these cases are still connected with COVID-19, and it's only going to escalate probably at this point in time between now and at least January 20th. Yes, they have made some kind of vaccine. There's like 2 vaccines out, I think, that are very effective. They use the word efficacy, I guess, to describe the effectiveness of it. And the thing about it is, you have this new one that's come out. It's from Moderna or something. It doesn't have to hit any extreme cold temperatures. It's something where it's like not close to 95% effective, I believe. And that's all fine, but it may not be available to the masses, the majority, till like April, I guess, somewhere around there, I believe. So what's going to happen if you look at this, the timeline of events that are going to transpire? January 20th is when I believe is the inauguration for Joe Biden. He should be going into office, hopefully with little or no resistance. But at that time, even with him in the office, what's going to happen between that time and April? Is Joe Biden going to mandate the mask wearing universally across the United States? Will he make it compulsory for others to wear this all over the U.S.? That's something I don't know at this point. If he does, more power to him. That will definitely be a relief for many people. Now, the thing about this too is that I think what's happened is that sadly the United States has become, it's not just in a complacency, it's like we're some kind of a rebellion. It's like a lot of people feel like they don't want to do something that they're instructed to do, like they feel forced and they don't want to do it. Well, the thing is, you don't look at it like it's a forced situation. Look at it as something that you're doing to help your fellow brothers and sisters across America, and do the right thing and make it where you're doing something, even if you're not comfortable wearing the mask, maybe just wear it anyway for other people. If you don't want to do it for yourself, then try to do it to help other people at this time. I mean, wearing a mask, I believe, is imperative to get this thing to a realistic level. And the thing about it is, we're talking, I was watching something on CNN one day, and it said, it's Dr. Sanjay Gupta. He's he's some renowned physician or something, and he's like a chief medical correspondent or something with CNN. I don't know, remember the exact title, but you could Google that, look that up or whatever. But he knows, obviously, he's very informative regarding the COVID-19 coronavirus. And he had stated, I think may have been Chris Cuomo that asked him this question. I don't know if it was Chris Cuomo, may have been Don Lemon. I asked him a question about, when the earliest time, I believe it would be, where we hit some sort of normalcy, which of course is very subjective in terms of this coronavirus, COVID-19. And if I remember right, he responded something like the summer of 2021. Now, I don't want to sound like overly negative or pessimistic, but I think based on the fact that this vaccine will not be readily available to the majority of the United States till April maybe, this and the fact that this thing is escalating very strongly right now, and we're probably, I'd say by December, we're going to be hitting around 200,000 confirmed cases a day and more. I don't see where this could really be at the normalcy by the summer of 2021. I think I would say likely that this thing is going to persist to some degree at a fairly strong level until we get to the latter part of 2021, maybe even early 2022, sadly, because what it is, we're so far behind on this now. And if I remember right, there was some kind of a blog on the internet, something about even the contact tracing, people aren't even going to be doing that as much or something, because it's gotten to a point where it's escalated so out of control. Really the thing right now is what people are going to have to focus on. I'd say presumably is trying to get the testing done and try to get this thing, or try to get it close to being eradicated as possible. And the thing about it is going back to what would actually be considered normalcy. I think this is something we don't really hear. I don't think talked about much on the internet or on TV. What number is the United States looking at per day as far as coronavirus cases on average per day? What would be considered a normal? So what would be considered a number that we could feel we could go outside and not take precautions, not worry about, the mask or even the goggles, or constantly, using a hand sanitizer, washing your hands frequently? What number of confirmed cases per day would we be looking at, which would be considered, a point where we wouldn't be in a state of fear and trepidation when we go outside? My guesstimate on this, I would say if we got it down to 5,000 confirmed cases per day or less, that would be more of a realistic number where you don't have to, resort to taking all these precautions, at least as much as usual. Because if you break it down, 5,000 confirmed cases per day for this country is really not that many. If you break it down by state, you would be averaging about 100 per 100 confirmed cases per state per day. And if that's the case, considering the states are so widespread, 100 for each state is really not that many. I don't think. I think that would be a point where it would be more plausible and realistic to say that this is something where it's gotten to a point where it has been controlled. I don't know if this thing is ever going away completely, because again, not to be redundant, but it has gone so out of control at this point in time. What are we going? I mean, will it ever be gone completely? I don't know if it will. And let's hope that this vaccine is going to be something that will be very effective. And it will be available to everybody by April. Now, I understand there's people that are getting it first that take precedence and priority over others, and maybe, I don't know if it's people that are very debilitated that might be at a higher risk if they have some underlying conditions. Elderly people, those people will, I believe, they get that first. Someone like me, average Joe, I won't be seeing this until April, probably, maybe late March at the earliest. I just gotta hope that I weather this storm at this time. I mean, even for me, it's just a lot of isolation, a lot of reclusive, energy, and it can get monotonous after a while. And what I want to do, I'm going to close with this by offering my prayers out to those that have this, that have contracted the COVID-19, or any people that are family of others that have had this, that happen to see this video. And I know a lot of people won't see this video. I may make one on my astrology, YouTube astrology channel, and talk about this as far as astrology and the significance of the COVID-19 mask wearing. But anyway, people, that'll conclude this YouTube segment. Until next time, people, Edwin Learnard saying stay out.